Well, welcome everybody to the Consumer Health Forum Policy Forum, and I apologise I can't be with you, but I'm passionate about the work that you are doing and which we're doing together. In particular to Leanne Wells and to Tony Lawson, but also to acknowledge Michael Brennan and Professor Stephen King and Chris Bowen and others who are involved during the course of today's forum. Now, of course, CHF is playing a critical role in the development of two new consumer-focused and consumer-driven health policies. One is in relation to the 10-year primary healthcare plan, and Leanne is representing the CHF on that. In particular, what we're looking at is over the course of the decade, expanding out the way in which the flexible care model can be developed across Australia. We've begun with the over 70s and the support for GPs to provide additional services, both after hours and over telephone, over teleconference, through the practice nurses. And this is about giving much greater flexibility in care and round-the-clock care to patients, and it will make a major difference. And so it builds on what we have with fee-for-service, but you've been co-architects of this, and I want to thank you and acknowledge that work. We're also developing through this program a real focus on rural and remote Australia, on providing the integrated primary healthcare model, which will bring together nurses, doctors, allied health workers, and to give them the platform to be able to practice across a range of towns. It's being designed by and with not just consumers, but also the medical workforce and the research community and the rural and remote community. And so it's a critical step forward as to how we develop things together. Beyond that though, we know that only recently new listings have made a major difference, whether it's for what we're doing in relation to breast cancer screening and MRI and PET scan for 14,000 and 10,000 patients a year on average, we expect, respectively. And that started only a couple of weeks ago on the 1st of November. In addition, very importantly, the new eating disorders MBS item. And that means that a patient with an eating disorder, and you've played such a role in this dramatic transformation, will have up to 60 consultations a year. And that allows for real hope, treatment, support and recovery. And for patients with eating disorders, so often women, so often younger women, it will make a real difference. That leads me to mental health, and together we've been working with you in terms of the great waves of support for mental health, and what we're doing there in terms of the $700 million national youth mental health and suicide prevention plan is critical. 500 of that is aimed directly at youth, and that includes expanding out the number of headspaces, expanding out the early psychosis youth support program, and expanding out the range of services for existing headspaces, but also building beyond blues work through what we're doing in terms of the Way Back program for discharge from hospital for people who are recovering from suicide attempt or suicidality, and then in particular working in Indigenous Australia and with seniors across Australia. All of this brings me lastly to the work of CHF itself, and Leanne and Tony, we've been pleased to support you with $2 million for your work in policy development over the current period. But one of the things that we did discuss was an additional role for youth and to have them out and working and being supported. And so from our meetings with CHF and with youth ambassadors, we were delighted to be able to add an additional $1 million focused exclusively on the Youth Policy Forum and the Youth Ambassadors Program. So I want to thank all of you and wish you well for today's CHF Policy Forum. Bring us your proposals, your ideas. I know you'll do it fearlessly, but let us have the best of your thinking, because you're already involved in the 10-year primary care plan, the preventive health plan, the work that we're doing on the Vision 2030 for mental health. And for that, I thank you and I honour you.